delivery system. Introduction *. The novel approach in which drug can instilled on the cul-de-sac cavity of eye is known as ODDS. *. Ophthalmic preparations are specialized sterile preparation of dosage forms designed to be instilled onto the external surface of the eye, topical, administered inside, intraocular, or adjacent, periocular, to the eye or used in conjunction with an ophthalmic device. The most commonly administered dosage forms are solutions, suspensions, and ointments. Various strategies for ocular drug delivery are considered, from basic formulation techniques for improving availability of drugs. ODDS can be mainly prepared as gels, ointments, microspheres, ocular inserts, and nanoparticles, etc. ODDS. 1. It increases accurate dosing. 2. It provides sustained and controlled drug delivery system. 3. It increases the ocular bioavailability of drug by increasing the corneal contact time. Disadvantages of ODDS. 1. Dosage form cannot be terminated during emergency. 2. It interferes with vision. 3. It is difficult in placement and removal. 4. 3 is occasional loss during intraocular barriers. 1. Tear. The precorneal barrier is tear film, which reduces the effective concentration of the administered drugs due to dilution by the tear turnover, 1L/min, accelerated clearance, and binding of the drug molecule to the tear proteins. 2. Cornea. The cornea consists of 3 layers, 7, such as epithelium, stroma, and endothelium, and a mechanical barrier to inhibit transport of exogenous substances into the eye. Each layer possesses a different polarity and a rate-limiting structure for drug permeation. 3. Conjunctiva. Conjunctiva of eyelids and globe is a thin and transparent membrane which is involved in the formation and maintenance of the tear film. The conjunctiva, or epiclera, is highly supplied with capillaries and lymphatics. 4. Sclera. The sclera mainly consists of collagen fibers and proteoglycans embedded in an extracellular matrix. Scleropermeability depends on the molecular radius, and it decreases roughly exponentially with molecular radius. 5. Choroid/Bruch's membrane. Choroid is one of the most highly vascularized tissues of the body to supply the blood to retina. The choroidal capillary endothelial cells are fenestrated and in humans are relatively large in diameter, 20 to 40 m. Bruch's membrane, BM, causes thickening with age. Is the internal limiting membrane, ILM. The ILM separates the retina and the vitreous and is composed of 10 distinct extracellular matrix proteins. 7. Blood-retinal barrier. Blood-retinal barrier, BRB, restricts drug transport from blood into the retina. BRB is composed of tight junctions of retinal capillary endothelial cells and RPE, called IBRB for the inner and OBRB for outer BRB, respectively. Methods to overcome barriers. Physical methods. 1. Iontophoresis. 2. Sonophoresis. 3. Microneedles. Physical methods. Physical force-based methods, initially utilized in transdermal drug delivery, generally require a power-driven physical device to deliver energy to the barriers, thereby enhancing transient drug. Transport. 1. Iontophoresis. It is the process in which direct current drives ions into cells/tissues. Iontophoresis. Application of a low-intensity electrical current enhances drug delivery across biological membranes by causing electrorepulsion and electroosmosis of the drug molecule. 2. Sonophoresis/ultrasound. It involves the application of a sound field at frequencies higher than 20 kHz to improve drug transport across biological membranes, including ocular barriers. 3. Microneedles. Microneedles, MLs, are micrometer-sized needles, or arrays of such, fabricated by adapting microelectronics tools. Applying MLs to biological membranes can create tiny transport pathways, thereby allowing drugs to permeate across these barriers. To date, numerous ML5 fabrication approaches have been utilized, resulting in a variety of shapes, sizes, materials, and configurations. Ocular formulations. Eye drug delivery systems to anterior segment of the eye. 2. Drug delivery systems to posterior segment of the eye. 3. Advanced delivery system. 4. Vesicular drug delivery system. Examples of ocular formulations: *Biomedics 38 *Acuvue *Catianorm. Eye drug delivery systems to anterior segment of the eye. 1. Eye drops. Drugs which are active at eye or eye surface are widely administered in the form of solutions, emulsion, and suspension. Generally, eye drops are used for anterior segment disorders as adequate drug concentrations are not reached in the posterior tissues using this drug delivery method. 2. Ophthalmic inserts. Ophthalmic inserts are sterile preparations with a solid or a semi-solid consistency, and whose size and shape are especially designed for ophthalmic application. The inserts are placed in the lower fornix and, less frequently, in the upper fornix or on the cornea. Classification of ocular inserts based on insoluble ocuserts. Insoluble ocuserts can be classified into two categories, such as reservoir system and matrix system. A. Reservoir system. In this system, the drug released either by diffusion or by an osmotic process. It contains respectively a liquid, a gel, a colloid, a semi-solid, a solid matrix, or a carrier containing drug. B. Matrix systems. The second category, matrix system, is mainly represented by contact lenses and particular group of insoluble ophthalmic devices. 2. Soluble ophthalmic inserts. Soluble inserts correspond to the oldest class of ophthalmic inserts. Soluble inserts, normally defined as erodible, monolithic polymeric device. 3. Bioerodible ocular inserts. These inserts are formed by bioerodible polymers, e.g., cross-linked gelatin derivatives, polyester derivatives, which undergo hydrolysis of chemical bonds and hence dissolution. Soluble ophthalmic drug insert. Soluble ophthalmic drug insert, SODI, is a small oval wafer, which was developed by Soviet scientists for cosmonauts who could not use eye drops in weightless conditions. A SODI is a soluble copolymer of acrylamide, N-vinyl pyrrolidone, and ethyl acrylate.